The Ashanti Regional Director of the Ghana Health Service, Dr. Emmanuel Tinkran, is advocating for a national dialogue to discuss the efficient and sustainable payment of electricity bills for hospitals. He emphasizes that health facilities will not be able to independently cover the cost of power, and any attempt to do so will burden the patients who patronize these facilities. These concerns were made after the Electricity Company of Ghana issued a recent disconnection notice to over 90 health facilities across the country for failing to settle their electricity bills. Citi News' Ashanti Regional Correspondent Hafiz Tijani reports.
Dr. Emmanuel Tinkran recounts an incident where a task force from the Electricity Company of Ghana disconnected power to a health facility in the Ashanti region while premature babies were in incubators. He says such actions do not only disrupt the operations of health facilities but also endangers the lives of patients.
Why we believe that the government should intervene is that the facilities as it exists right now will not be capable of paying full electricity bill in this country. They can support, as we are saying, because when you ask the electricity people, some of them are paying, but they can't pay for the full cost of electricity because the only way is to put it on the patient, and the patient are already suffering. It's a burden. So it's not workable. It's not workable. And it's it will be immoral to disconnect electricity. Because there was an incident in one of our hospitals whilst children were in incubator, and then they disconnected the electricity. You see, it doesn't make sense. Because, you see, it's money that you need. But we are health workers. We are talking about people's lives.
The Electricity Company of Ghana recently threatened to disconnect power to 91 hospitals due to their outstanding debts. In the Ashanti region, 15 hospitals, including the Komfo-Anokye Teaching Hospital, received disconnection notices as they collectively owed over 50 million Ghana cedis. Despite engagement between the Ministry of Health and the management of the Electricity Company of Ghana, Dr. Tinkran emphasized the need for a national dialogue to permanently address the issue.
Anytime they disconnect, we go and engage them and they reconnect. But the bill is still there. The bill is still there. You see? So we need a national dialogue on some of these things because for me, being in health profession for the past 33 years, I believe this is the hard time for everybody to bear. And it's the patients who are suffering.
Addressing the 2023 annual performance review of the Ashanti Regional Health Directorate, Dr. Emmanuel Tinkran reveals plans to expand health facilities to combat the rising maternal mortality rate in the Ashanti region, which increased from 134 to 167 per 100,000 live births. Health authorities in the Ashanti region are emphasizing the need for a permanent solution in the payment of electricity bills of hospitals to avoid a halt in the operations of health facilities. Hafiz Tijani, Citi News, Kumasi, Ashanti Region.